So are you annoyed by the thousands of Medicare ads on TV that are completely misleading? Me too, but that's about to change. Stay tuned. Hey guys, my name is Wesley and I make content about Medicare. I like to keep things short, sweet, simple, and get right to the point. So let's dive right in. So let's start this off by setting the scenario. So during the fall, it's almost impossible to watch TV without seeing an ad for Medicare. You got guys like Joe Namath and William Shatner, people that you know, that you relate to, peddling Medicare plans just to get you to call the 800 number and get sold by an agent on the other end of the line. Just recently, I had a client of mine give me a call that says, hey Wes, I want to get one of those Medicare Advantage plans for my husband because I see that he can get, vision, hearing, and dental all for free included in the plan instead of us paying for it. And I talked to her and I'm like, well, he has a really good Medigap plan. Like, there's consequences if he leaves that. He got it when he first was eligible. It doesn't even exist anymore. Like, are you sure you want to make this switch? She's like, no. I don't want to leave the Medigap plan. I just want to add the Medicare Advantage. And I had to explain to her, like, you can't have both. You have to have one or the other. And she got kind of annoyed, not at me, but she was annoyed because she's like, well, they don't make it seem like that on TV. I'm just mad because on TV, they make it sound like anyone can take advantage of these plans and get the free vision, the dental, the hearing, and all that kind of stuff. And I said, well, they can. They just don't let you know that, you have to choose between original Medicare, Medicare Advantage, or Medigap. Now, just to know, these ads that you see on TV are made by insurance companies. They're not made by Medicare. They're not made by CMS, which runs Medicare. They're insurance companies who are literally using marketing to get you to call the 800 number. And it works really well because otherwise they wouldn't spend the money to do it. However, now they're considered misleading. Or should I say they were always misleading, but now there's more regulations in place. So we're probably going to see less ads this coming year in 2023 going into 2024 regarding Medicare plans. A lot of times people will say, well, is this a scam? How can they do this? Well, technically it's not a scam. It's why they're able to do it, but it is very misleading. And this is what I mean by that. When you see an ad on TV, you got someone like Joe Namath, right? Someone you can relate to, someone you know, and someone you trust. He's the one pushing the plan. He's the one that gets your trust as a viewer and has you so enamored by what he's saying that you believe that you can get all the things that Joe is talking about. All you have to do is call the 800 number on your screen. Well, this is what happens when you do that. Essentially, that 800 number you're calling connects you to an agent. That agent may be either paying for the lead, meaning you're the new lead. They might pay anywhere from $50 to $125 for a live transfer call to get you on the phone to try and close you on a Medicare Advantage plan. Think about that. If you're an agent and you just spend $125 for a live transfer lead, someone who already raised their hand and said, yes, I'm interested in this, they're going to probably say whatever they can to close. Is it right? No. But does it happen? All the time. Next, the agent you're talking to most likely lives nowhere even near where you live. Let's say you're calling from, Prince William County, Virginia. Most likely that agent's going to live at least 2, 3, even 5, 7 states over. They have no idea where you're from. They have no idea about the traffic patterns, the networks, anything like that. Everything they're doing is looking it up online, which is something they can do, but it makes a difference when you have a local broker who knows the area better to help you when it comes to these plans. Let me give you an example of why this makes sense. So I had a client who was, I enrolled him into a great Medicare Advantage plan. And then, somewhere throughout the year, he got something in the mail or saw an ad on TV and he decided to call the number. Right? Instead of calling me, he decided to call the number. That's fine. He calls the number and the guy on the line had paid for that lead. So when he had my client on the phone, he was doing everything he possibly could to change this gentleman into a plan that wasn't going to work for him. Now, what my client wanted was Medicare Part B premium give back. But what he was a dual who wasn't even paying Part B premium. Think about that. The guy was getting his Part B premium paid for by the state, but he saw the advertisement that he'd get money put back on his Social Security check. So he got excited. Hey, I want some extra money. I need this extra money per month. So he calls the 800 number and the agent who answered the phone literally was able to enroll him into a plan that did not work for him. Of course, I had to reverse the entire situation, file a complaint and all that kind of stuff. We worked it out, but this happens on a daily basis. And the insurance carriers are really no help because they get so many thousands and thousands of requests that a lot of times things will get flagged or they'll go through the cracks or, people get signed up for plans all the time without their consent. It happens. And these Medicare Advantage TV ads are a big part of that. So now that we're in 2023, we're going to start seeing less of these ads. They're more regulated by the federal government, which is a good thing. And we'll see how this pans out because I'll tell you what, if you see an ad on TV that's claiming something, it may be true. It just may not be necessarily true for you. It's my recommendation that you always contact your local broker. Whoever you originally signed up for as your or signed up with as your agent, that's who you should be contacting. But if you don't know who that person is, then definitely find someone local in your area that you trust that can go over all the differences of these plans and what each offers. Because the number one thing I see is people are really excited about getting that Social Security money put back on their check, that Part B premium give back. That doesn't necessarily mean it's the best plan for that individual. And it also doesn't mean that that's even available in the county you live in. So for example, in my county, Los Angeles County, it is available, but I know in other counties, Part B premium give back is not available. But the TV ad that you see says it is. Joe Namath told you it was. William Shatner told you it was. And before I go, guys, I just want to say, if you got any value out of this, definitely feel free to like, comment, and subscribe, turn on your notifications, check out the links in the description, as well as get a copy of my book. It's It's going to give you 15 actionable steps to cut your prescription costs. Prescription costs are going to be on the rise until the Inflation Reduction Act kicks in. So definitely want to make sure that you are saving as much money as possible. Now, let's wrap this up. So the Medicare TV commercials you see are not scams, but they definitely are annoying. There is enough complaints to the FTC that they are now going to be heavily regulated. Then hopefully that means that we see much less of them. And if we do see them, they're a lot more clear with their intent, because before all they were doing was using advertising and marketing 101 to hook me into giving them a call to see if we could get the benefits that they're claiming. Now those benefits do exist, but it is definitely more advisable to connect with a local broker in your area. If you're in Southern California, feel free to reach out to me. If not, definitely go on Medicare.gov, look at finding a broker in your local area that can go over all these plans with you. And if you have any questions, someone in your local area should be better assessed to address the plans and how each plan works, rather than a guy that lives 4 states away that just paid $125 and wants to close because he's already negative on his budget for the day. And that wraps it up here, guys. There's a couple videos that YouTube thinks that you should watch now, and I'll see you in the next one. Take care.